In this video, I want to highlight cognitive behavioral therapy, or CBT. In my very last video, I discussed how some of our thoughts can guide how we feel about something, and then our feelings, what we feel about certain things, kind of guide our behavior, to the point that you may have this pattern where if you have this negative thought that I can't get that job, for example, that thought influences our feelings. So we feel negatively when we think about that specific job or trying to get a job in that field, which then influences our behavior. I'm just not going to apply for those types of jobs. I'm not even going to throw my hat in the ring because I can't get it. And so those negative, intrusive thoughts kind of impacting our feelings and behaviors related to specific things. Now, in cognitive behavioral therapy, otherwise called CBT, some prominent strategies include identifying some of these negative and unhelpful thoughts. At times, thinking through what are the causes of these thoughts? Where did some of these thoughts emerge from? Challenging these negative thoughts. Why do I believe I'm not good enough for the chess team when I keep serving out piping hot L's on the chessboard? Why do I believe I'm not good enough for that field or that occupation, although I have prominent training in that field? Why is it that I'm already in this field and I'm amazing and I'm crushing it, but I don't believe that I'm ready to be a supervisor yet? Why do I believe that although I know everything there is to know about that specific topic, I'm not ready to become an entrepreneur and jump into that field because I believe I can't make it? And just all of these negative thought patterns and kind of identifying where they come from and challenging them. And then oftentimes testing these beliefs in real life. So again, I keep serving out piping hot L's on the chessboard, but I believe I can't make the chess team. Let me try out for the chess team and see what happens. Testing that out. Seeing if that negative thought and that negative emotion and that negative feeling really has any sort of real world applicability when you're trying it out. And then also understanding that if there is some sort of negative reaction that happens when you try something, that there could be some alternative explanation. So instead of my friend hasn't responded to my text in a long time, they must not like me. Instead, it could simply be they're working a graveyard shift. They're a nurse. They're doing a lot right now, and they unfortunately can't respond at this very moment. Other CBT strategies, trying out meaningful and enjoyable activities as a potential strategy, things that that person enjoys, and also identifying coping. So ways that that person can cope. So using different coping skills to kind of address some of those negative thoughts. With the idea also being, changing some of your negative thought patterns as relates to CBT. Well, the CBT strategy, changing some of your negative thought patterns because, again, these thought patterns may influence our feelings, which ultimately may influence our behaviors. So that's a very brief definition of CBT. I hope that you find this helpful. Thank you.